How do different MRI sequences reveal kidney tissue details? Imagine looking inside the body with a camera that can see different tissue properties without cutting open anything. That's what MRI scans do, especially when it comes to kidneys. They use different sequences or specific ways of capturing images to highlight various tissue features. These sequences help doctors understand kidney health and detect diseases like kidney cancer more accurately. One common sequence is called T1-weighted imaging. It produces high-resolution pictures that show the kidney's anatomy clearly. T1 images help distinguish the outer part of the kidney, called the cortex, from the inner part, known as the medulla. Changes in T1 relaxation times can indicate tissue damage or scarring, which is common in chronic kidney disease. There's also a special technique called T1 mapping that measures the exact T1 values in tissues. This can help identify abnormal growths or fibrosis without needing contrast dyes. Then there's T2-weighted imaging. This sequence is very sensitive to water content in tissues. It's useful for spotting swelling, inflammation, or cysts in the kidneys. T2 mapping can measure the T2 relaxation times precisely, helping doctors tell apart benign cysts from malignant tumors by examining differences in tissue composition. Diffusion-weighted imaging, or DWI, measures how water molecules move within the kidney tissue. When diffusion is restricted, it often means there's increased cellularity or fibrosis. DWI is particularly helpful for detecting early kidney damage and characterizing tumors. The apparent diffusion coefficient, or ADC, is a number derived from DWI that provides a quantitative measure of tissue cellularity and health. Blood Oxygen Level-Dependent MRI, or BOLD MRI, looks at how much oxygen is in the kidney tissue. It uses the magnetic properties of deoxygenated blood to assess tissue oxygenation non-invasively. This is especially useful in conditions like renal artery narrowing or chronic kidney disease, where oxygen delivery may be compromised. Changes in T2* values from BOLD scans can reflect how well the kidney is functioning. Contrast-enhanced MRI involves injecting a gadolinium-based dye to see blood flow and tissue perfusion. It's very effective for identifying and characterizing kidney tumors, as it highlights vascular structures and helps differentiate cysts from solid masses. By comparing images before and after contrast, doctors can spot even small tumor parts that might be missed otherwise. Finally, multiparametric MRI combines several of these sequences into one comprehensive exam. It provides a detailed picture of kidney structure, blood flow, oxygen levels, and tissue makeup all at once. This approach allows for a thorough, non-invasive assessment of kidney health, helping detect problems early and plan personalized treatments. In practical terms, these MRI sequences can reveal subtle changes in kidney tissue that might happen before the kidney's function declines. They help distinguish benign from malignant growths and guide biopsy decisions. For patients with impaired kidney function who cannot receive contrast dyes, sequences like DWI and BOLD are especially valuable because they don't require contrast agents. In summary, each MRI sequence taps into a different property of kidney tissue, relaxation times, water movement, oxygenation, or blood flow to create a detailed map of kidney health. When used together, they give doctors a powerful tool to diagnose and monitor kidney diseases and cancer accurately and safely. Always remember to consult healthcare professionals for personalized advice, as individual cases can vary widely.